Have you noticed your legs feeling weaker as you age? You're not alone. Many seniors, over the age of 60, experience a gradual decline in leg strength, often without understanding why. But here's the truth. Losing strength in your legs isn't just part of getting old, it's often the result of preventable habits, health changes, and lifestyle factors. In this video, we'll explore the top 5 reasons your legs may be getting weaker after 60, along with simple, science-backed tips to help regain strength, improve balance, and prevent dangerous falls. Number 1. Muscle loss, sarcopenia, the silent strength stealer. As we age, one of the most overlooked and misunderstood changes in our body is something called sarcopenia, the gradual loss of muscle mass and strength. It starts slowly, often unnoticed in your 40s or 50s, but after the age of 60, the process tends to speed up, and it can have a major impact on your daily life if not addressed in time. The causes of sarcopenia can be both natural and lifestyle-related. Age-related hormonal changes. As we grow older, our bodies produce less testosterone and growth hormone, both of which are important for maintaining muscle mass. Lack of physical activity. Muscles are like use it or lose it assets. Without regular activity, especially resistance exercises, muscle fibers shrink and weaken. Poor nutrition. Many seniors don't get enough protein, vitamin D, and essential nutrients that help build and repair muscles. Leg weakness, due to sarcopenia, can lead to a loss of independence, increased risk of hip fractures, and even long-term disability. But the body is incredibly adaptable, even in your 60s, 70s, or 80s, and you can rebuild strength with the right mindset and routine. Sarcopenia isn't just about losing muscle tone. It's about losing your ability to walk confidently, climb stairs without help, or even get up from a chair without feeling weak or off balance. This silent thief slowly robs your legs of the strength and power you once had, making simple movements more difficult, and increasing the risk of falls, injuries, and loss of independence. The warning signs. Sarcopenia often creeps in without obvious symptoms. You may notice you feel more tired or winded doing things you once handled easily. Your legs feel shaky or unsteady, especially when standing up or walking. You struggle to carry groceries, lift objects, or perform daily tasks. You've had more close calls with falls or stumbles. If you recognize any of these signs, don't ignore them. Muscle loss is reversible, but only if you act early. Bonus tips. Simple and effective steps to stop muscle loss and even regain strength. Add strength training to your weekly routine. You don't need a gym membership. Bodyweight exercises, resistance bands, or light dumbbells at home can work wonders. Aim for at least 2 to 3 days per week. Don't neglect vitamin D and B12. These vitamins help with muscle function and energy. Get your levels checked, and supplement if needed, or include foods like fortified dairy, fish, and leafy greens. Prioritize protein at every meal. Seniors often eat less protein than needed. Aim for around 1.0 to 1.2 grams of protein per kilogram of body weight daily, unless advised otherwise by your doctor. Foods like eggs, lentils, chicken, Greek yogurt, and nuts are excellent choices. Talk to your doctor. If you suspect sarcopenia or are struggling with weakness, talk to your healthcare provider. They can assess your muscle health and recommend safe, senior-friendly workouts or physical therapy. Remember, muscle loss is not just a natural part of aging, it's a manageable condition. And with a few smart changes, you can stay active, balanced, and independent for many more years to come. Number 2. Poor nutrition. After the age of 60, what you eat matters more than ever. Your muscles, bones, and energy levels all depend heavily on the nutrients you give your body. And when your nutrition is lacking, one of the first areas to suffer is your leg strength. Common nutritional mistakes seniors make. Not eating enough protein. Protein is the building block of muscle. But many seniors don't get enough due to smaller appetites or limited diets. Without it, your body can't repair or rebuild muscle tissue, especially in the legs, where the largest muscles are located. Dehydration. Seniors often drink less water, leading to dehydration, which causes fatigue, joint stiffness, and poor circulation, all of which affect your leg strength and mobility. Skipping meals or eating convenience foods. Ready-to-eat processed meals, canned soups, and frozen dinners are often high in sodium and low in real nutrients. These can lead to inflammation, water retention, and even muscle wasting over time. Lack of essential vitamins and minerals. Important nutrients like vitamin D, calcium, B12, magnesium, and omega-3s all play a role in muscle and joint health. Without enough of these, your legs may feel heavier, weaker, and more prone to cramping. Many seniors unknowingly eat diets that are low in protein, missing key vitamins, or too reliant on processed foods. Over time, this poor nutritional pattern leads to fatigue, muscle breakdown, reduced coordination, and a greater risk of falls or mobility issues. It's never too late to improve your nutrition and rebuild strength. Many seniors notice dramatic improvements in energy, mobility, and balance within just a few weeks of making healthier food choices. By simply eating more nourishing, whole foods, and cutting out the empty calories, you give your legs and muscles the support they need to thrive. Bonus tips for all seniors. Prioritize protein at every meal. Include high-quality protein sources, like eggs, lean meats, fish, lentils, Greek yogurt, tofu, or cottage cheese. Aim to eat 20 to 30 grams of protein per meal if possible. Avoid empty calories. Cut back on sugary drinks, white bread, fried foods, and snacks with little nutritional value. These can contribute to inflammation and muscle fatigue. Add muscle-supporting nutrients. Vitamin D supports muscle function and prevents weakness. Found in fortified dairy, salmon, eggs, and safe sun exposure. Vitamin B12 helps with energy and muscle coordination. Commonly low in older adults. Talk to your doctor about supplements if needed. Stay hydrated. Don't wait until you're thirsty. Keep a water bottle nearby, and aim for 6 to 8 cups of fluids daily, more if you're active or live in a warm climate. If you're unsure you're getting enough nutrients from food, a good multivitamin made for seniors can help fill in the gaps, but always talk with your doctor before starting supplements. If your legs feel weak or heavy, the problem might not be in your muscles, it could be on your plate. Change what you eat, and you just might change how you move, feel, and live. Number 3. Joint pain, arthritis and fear of falling. As we age, many seniors begin to experience joint stiffness, aching knees, sore hips, and reduced flexibility, especially in the lower body. These issues are often caused by arthritis, age-related wear and tear, or past injuries. But over time, they don't just cause discomfort, they lead to a hidden and serious consequence. Fear, even one fall, or witnessing someone else fall, can create a lasting fear. Seniors often start avoiding stairs, walking less, or holding on to furniture to move around. While this may seem like a safe approach, it actually leads to muscle atrophy, reduced confidence, and higher risk of falling again. Yes, the fear of falling is a very real concern among seniors. And it's not just psychological, it affects how you walk, how you stand, how much you move, and ultimately, how strong or weak your legs become. This fear can become a silent contributor to muscle loss, decreased confidence, and physical decline. Causes of leg joint pain in seniors. Osteoarthritis, the most common type of arthritis in older adults. It causes the cartilage in your knees, hips, and ankles to wear down, resulting in stiffness and swelling. Past injuries. Old knee or hip injuries can cause long-term joint problems if they weren't treated properly. Bursitis and tendinitis. Inflammation in the soft tissues around joints can also make movement painful and limit mobility. When joints hurt, the natural reaction is to move less. But unfortunately, the less you move, the weaker your muscles get, especially the ones that support those same joints, like the quadriceps, hamstrings, calves, and glutes. This creates a dangerous loop. Joint pain leads to inactivity. Inactivity causes muscle loss. Muscle loss reduces support for joints. Weak joints hurt more and increase risk of falling. Bonus tips. What you can do to regain strength and confidence. Gentle movement is better than no movement. Even if you have arthritis, it's important to stay active. Try low-impact exercises, like water aerobics, seated leg lifts, walking with support. Movement helps lubricate joints and strengthen surrounding muscles. Gentle stretching and balance exercises, like standing on one leg while holding a chair, can help you build stability and reduce the fear of falling. Strong muscles reduce the stress placed directly on your joints. Focus on hamstrings, calves, and glute exercises using resistance bands or light weights. Talk to your doctor about joint pain. There are many safe treatments for seniors, from anti-inflammatory foods and supplements to physical therapy, heating pads, or medications. Joint pain is common, but it doesn't have to control your life. With the right approach, you can manage arthritis, overcome the fear of falling, and rebuild the strength in your legs. It's never too late to improve how you move, how you feel, and how confidently you live. Number 4. Inactivity and sedentary lifestyle, the hidden cause of weakening legs. A sedentary lifestyle is one of the biggest and most overlooked reasons why leg strength starts to disappear in seniors. The muscles in your thighs, calves, and glutes don't just lose power, they begin to shrink, stiffen, and weaken when they're not used regularly. And over time, even simple activities like getting up from a chair, walking to the kitchen, or stepping into the shower can become difficult or even dangerous. Inactivity weakens your legs. When you don't use your leg muscles regularly, they begin to shrink and lose mass. This is called atrophy, and it affects balance, mobility, and endurance. Sitting for long hours reduces blood flow to the legs, which can cause numbness, cold feet, swelling, and a higher risk of blood clots. Without regular motion, joints like the knees, hips, and ankles become stiff and harder to move, making walking and bending more painful. Your legs are your foundation. They carry you through life and give you independence, freedom, and strength. When you stop using them, you risk losing them, but you can regain that strength, even after years of inactivity. Sedentary lifestyle is one where most of your day is spent sitting or lying down, with very little movement. It might include sitting for hours watching TV, long periods of reading, or using a phone, tablet, rarely walking, stretching, or exercising, avoiding physical activities or outdoor activities. Bonus tips: ways to get moving again. Set a move every hour reminder. Every 60 minutes, stand up, stretch, and walk around the house for a few minutes. This helps reactivate your leg muscles and improve circulation. Try gentle chair exercises. Seated leg lifts, ankle circles, or arm movements while sitting in a chair can be effective for building strength without strain. Even a 5 to 10 minute walk around the house or yard twice a day can rebuild strength and stamina over time. Stay socially engaged. Movement often happens naturally during social activities, like visiting friends, attending group classes, or even dancing. Don't isolate yourself. Connection is good for both your mental and physical health. Your legs are your foundation. They carry you through life and give you independence, freedom, and strength. When you stop using them, you risk losing them, but you can regain that strength, even after years of inactivity. Number 5. Circulation problems and underlying health conditions. If your legs have been feeling weaker, more tired, or even a little numb lately, the issue may not be your muscles at all. Instead, the problem could be deeper and more serious: poor circulation and hidden health conditions that quietly rob your legs of the strength and energy they need to support you. Healthy legs need oxygen-rich blood to fuel the muscles, remove waste products, and keep tissues alive and well. But as we age, blood vessels naturally narrow and stiffen, especially in people with high blood pressure, diabetes, or cholesterol issues. Ignoring circulation problems or medical conditions can lead to serious consequences like falling due to leg weakness or numbness, developing ulcers or infections in the lower legs, losing independence due to chronic pain or mobility issues. This can lead to a condition called peripheral artery disease, where blood doesn't reach the legs efficiently. When this happens, your muscles can't perform the way they used to. You might feel cramping or heaviness in the legs when walking, Cold feet or numb toes. Pain that eases with rest, but returns with movement. Legs that tire out faster than normal. Slow healing cuts, or swelling around the ankles. All of these are signs that your legs aren't getting the circulation they need to stay strong. If your legs are aching, swelling, or getting tired easily, listen to your body. It may be trying to alert you to something more serious going on inside. The sooner you address circulation issues and health concerns, the sooner you can start feeling stronger, more energetic again. Hidden health conditions that affect your legs. Diabetes. High blood sugar can damage nerves and blood vessels in your legs, leading to weakness, numbness, and poor healing. High blood pressure damages artery walls and reduces blood flow to extremities over time. Heart conditions. A weak heart means slower circulation, which leads to less oxygen reaching your legs. Varicose veins or blood clots. These conditions interfere with blood returning to the heart, causing leg swelling and fatigue. Bonus tips. How to support circulation and protect leg strength. Move often, even gently. Movement is one of the best ways to boost blood flow. Walking, leg lifts, or even light stretching can make a big difference, especially if you're doing it several times a day. Keep your feet elevated when resting. If your legs tend to swell, raise your feet above heart level when lying down. This helps blood return to your heart and reduces pressure in the veins. Stay hydrated and don't smoke. Dehydration thickens the blood, and smoking narrows blood vessels, both terrible for circulation. Aim to drink 6 to 8 cups of water daily, and avoid smoking at all costs. Control your blood pressure, cholesterol, and blood sugar through medication, diet, and regular doctor visits. These conditions directly affect your blood vessels and nerve health. Eat a circulation-friendly diet. Include foods that support heart and vessel health. Leafy greens, rich in nitrates. Fatty fish, omega-3s. Berries, antioxidants. Garlic and turmeric, anti-inflammatory. Avoid excess salt, fried foods, and sugary snacks that increase inflammation and worsen circulation. Your legs carry you through life, but they need strong blood flow and good health to do their job. Take care of your circulation, treat underlying conditions, and keep moving. It's never too late to reclaim your strength and confidence again. So there we have it, viewers. As we grow older, it's easy to assume that weak legs are simply a normal part of aging. But the truth is, while change is inevitable, losing your strength and mobility doesn't have to be. In this video, we've uncovered the 5 most common, yet often overlooked, reasons why your legs may be feeling weaker after the age of 60. These issues don't happen overnight. They develop slowly, through habits, health conditions, and lifestyle choices. But here's the good news, it's never too late to take action. Your legs are the foundation of your independence. They help you get out of bed, walk with confidence, climb stairs, play with grandchildren, and enjoy the life you love. Even small, consistent efforts can lead to incredible improvements in how your legs feel and function. Whether it's adding more protein and muscle-supporting nutrients to your diet, doing gentle exercises at home each day, consulting with your doctor to manage underlying health conditions. Aging is natural. With the right care, the right mindset, and the right habits, you can protect your legs, restore your strength, and continue living with freedom, confidence, and dignity. So don't wait for tomorrow. Start today, because strong legs lead to a strong life. If you found this video helpful, give it a like, and share with the loved ones. Subscribe to our channel for more practical, senior-friendly tips. Let us know in the comments what's helped you stay strong and active after 60. Thanks for watching. We will meet you in the next video. Take care all of you.